Good evening, listeners on World Heart Day. What an absolute pleasure and honor it is to have Dr. Sanjay Mehrotra, Director, Cath Lab of Narayana Health Group of Hospitals, and a very renowned interventional cardiologist amidst us today. So, a very warm welcome to you. Thank you very much.
Thank you
for taking the time out,
calling us to this beautiful facility, and I'm so amazed and I'm actually excited and happy about the way you have brought this place up. And of course, I know Prasad for a long time to his previous connections with me. So I'm quite impressed by the vision you have.
Thank you, sir.
And I think the facility is showing its effects already with your 500 Cath Labs which are installed in the country and abroad, I suppose. Yes. I didn't ask that question. So I'm quite impressed.
Thank you
with
so
the facility.
much.
And I think
from you, it means a lot, sir.
And I think the important thing would be to keep the quality and the discipline of work at standards which are probably you can call it Western standards, although they are deteriorating and we need to go up. That is the future of the Asia Pacific, which is now going into it. The geopolitics is playing its own game.
It is.
So we need to be part of that.
So earlier you spoke about us as a race showing indiscipline compared to the Western races. So do you attribute very high incidence of cardiovascular disease in the subcontinent to indiscipline, sir? What do you think, sir? Why is it that we have an incidence which is much higher than our Western counterparts?
More to do with our quality of life in terms of our eating habits, I suppose. And it's also to do the way our I would say our economy has developed towards availability of food of all kinds and affordability, which has reached a certain point where there is no lack of food anymore. There's no famine in this country anymore. I don't think so. And the country is rich now. I mean, probably the richer in this country would be as big as many other countries or even bigger than that, although there's a lot of poverty as well. But I think that probably is improving. But the main problem is our diet.
Absolutely.
Diet and availability of simple processed food. And we've always been brighter because we ate a lot of carbs in our menu. But that probably has become too much now, because those days are gone where Indians were walking on feet and going long distances, or a person will eat in the morning and then he may not get the food. He will walk 10 kilometers and come back home 10 kilometers. By the time his all carbs are gone.
Yes.
So the intake of higher carbohydrate rich diet and less protein diet made him smarter because the brain works better. Physically, we were never very big, so we were not athletic people.
Yes.
But that has changed because of the education and understanding. And our cricket teams, you see young guys as athletic as any other country.
Yeah.
They are even more athletic now.
Definitely.
And this young team which defeated Pakistan yesterday, look, there are new guys. They're not the same. They're not. You breed and they're athletic. So I think as far as the athleticism is concerned, it is improving by transfer of information, which is now available to everybody in the form of an handheld device. So we cannot forget this handheld device's contribution in information and technology, because everything is connectable now. And the second problem which I feel is probably, which is being thrusted on us, is the quality of food available to us. We've become more and more eaters of processed food, and I think that is the biggest problem, especially the simple sugars. I feel that the whole world's problem, and more so in India, is availability of very simple sugar-rich food.
So any 3 processed foods very rich in simple sugars that you see in everyday diet that you...
Maida is the worst, and simple sweets. Sugar, white sugar, or whatever sugar, even brown sugar, or any form of sugar. And the problem is we eat too many times.
True.
Yeah, we eat, every chai would have one samosa or one biscuit, that maida is not good for you, because that maida causes insulin spike. And every time you eat carbohydrate, there is insulin spike.
Yes.
And that's why you see obesity in young people. PCOD has become, infertility is very common now. We never heard about infertility in our days when we were students. Infertility has become very common. Diabetes is, I don't see any patient who does not have diabetes in my outpatient. 80% of the patients who have come with disease, heart disease, have diabetes.
Yeah.
And that is all because we have been eating since we are 5 to 6 years away. See, if you don't feed a child sugar, because it doesn't exist in nature.
Exactly.
Whatever doesn't exist in nature, you should not eat. Simple.
So we have a genetic predisposition as Asians to cardiovascular disease, but what do you think, sir, can the country do to bridge the huge gap? We still lose about 5 million Indians every year to cardiovascular disease alone.
There is
Times number of people we lost to COVID.
there is a serious need of educating our youngs what is not good for them in terms of food. Unfortunately, today's kids get bored with homemade food. And that is the problem. You have gone processing everything in your eatable items. So my saying is, everything which has got a barcode has a problem.
Anything else, sir, a company like us can do? It's painful for us. One of the things that's on our mission is to democratize cardiovascular care. What more can we do to take cardiovascular care to the last mile in the countries?
Use artificial intelligence to start doing whatever you do in all walks of training, all walks of producing, all walks of creating, because you cannot get away from that. It is just future.
Absolutely.
And the future is not something which you can ignore and neglect.
Not at all.
It will take away everything. It will take away. And those people who want to become smarter, they have to use the smart technology.
Yeah.
So involvement of, I have all the information. If I have to search, everything is available at my phone. So this device has become your future for interacting with wherever you want to interact, whatever you want to ask. Yes, it requires fine-tuning. It requires development of agentic AI.
Yes.
Which will do a certain job more specifically. Because see, people don't understand what AI is right now. They think that everything can be done, but you need to provide information to the system for it to react to it.
Yes.
So using the modern technology, modern platforms of technology with creating patches of artificial intelligence where you want to, democratize the... I was asking Dr. Shippy this question the other day, that there's a lot of variability in people's opinion about how to treat coronary artery disease in this patient versus this hospital versus that hospital. There is unindicated angioplasty being done, and I can say it because I'm not taking any names now. 40-50% lesion, and you do an angioplasty, which is not indicated. Now, is there a control? So I gave a lecture to a group, I will not take the name, somebody who's big in the country, right? Being big in the country and trying to come in this arena of healthcare delivery. And I was given to talk about transparency, affordability, and ethics of medical healthcare. So the credibility gives you a lot of references. People come from other organizations to take opinions, especially when we have become more than now almost 25 years old. So your credibility goes by quality of service. Now, who's the leveler? How would you try to understand that that person got an opinion from another hospital, will need the angioplasty, and you come here and I say you don't need it? So there are two opposite difference of opinions. Who is the leveler? Technology, information in your hand. And that will become the leveler, because those people who are advising, suppose you go to a place and you put on ChatGPT itself. I'm 50 years of age, I have got diabetes, I've got a 30-40% lesion, and I've got this lesion which is read as 70%, and I have diabetes, I have hypertension, these are my disease categories, and the image goes onto that. You can actually take a picture of the image and the ChatGPT will read it. It is going to read it. If not now, another 1 to 2 years, it will read it.
Yes.
I will give you opinion. And if the opinion doesn't match the correctness of the treatment, which is evidence-based by the service which has been offered by a hospital in the form of a doctor, then that doctor's credibility is going to go down. It will be tested on that device. That's the future.
So you rightly said, sir, that information disability or information gap is going to be bridged by
Very quickly.
Very quickly.
Very quickly.
And I think we live in a world where connected decisions, smarter decisions, informed decisions can be made about healthcare.
Absolutely, absolutely. That's the future.
We
should work in that direction. Now, how do we do it? Whether we do it in process development of how the IVS would be read, or whether we do it how the medical fraternity will provide correct, affordable, ethical, and transparent delivery of healthcare.
It's our dream as well, sir. As
It will happen.
That
It will happen.
on one hand we are a provider, but on the other hand we are a consumer as a consumer as well.
Yeah.
And it pains to me that a lot of my relatives get treatment for diseases that they essentially didn't need treatment for, or over-treated. So, or worst case, misinformed, which causes anxiety.
This would not work in the country. And I think that self-driven, there is, of course, so in one of the meetings, there was a discussion that there is corruption in delivery of healthcare. That corruption is not in the form of a corrupt government or anything. It's corruption in the form of decision-making.
Exactly.
You call it wrong decision, you call it correct decision, it's corruption. Now, what is the level of that corruption? Whether that corruption is something which can be brought into some kind of uniformity? Will the government do it? I think the technology will do it. Government cannot.
I completely side with you. I think AI will bridge the information symmetry.
Yeah.
And that will bring about honesty in healthcare
delivery. And I think that is needed for the common man wants that my parent, my father, my sister, my brother should get what is required to be done. He's ready to spend money.
Yes.
But he doesn't want to get the wrong treatment, wrong information. That's where the future lies. Yeah.
So thank you very much once again, sir. I mean, means a lot that you had such rich words of praise for us. And
very nice.
Passion.
Yes.
For training, sir. So thank you very much. And I hope our listeners would have enjoyed the freewheeling conversation on World Heart Day.
Sure.
Listening in from one of the biggest experts in the area. Thank you so much.
Sure.
Thanks.